Here's a flat foot position. In this position, you can see the heel or the calcaneus is turned inward. The medial part or the inside part of the arch is completely collapsing in on this runner. When they go into their running mechanics, they want somebody who overpronates. Their foot rarely goes into supination. So they do a great job of getting in and controlling shock, but they do a poor job of the backside running mechanics, which is propelling your body forward. This type of runner needs to get into a shoe that produces support and stability, and that's what we see here. As we put them in a support stability shoe, you see less rear foot or heel turning inward and better control of that pronation and better supination or propelling the athlete forward during their run. This is a shot without their orthotics in, and it does a pretty good job of controlling the foot position. Now we see the athlete with not only the control shoe, but also an orthotic inside of their shoe. This produces even greater amount of support and control of that pronation and helps the athlete produce backside running mechanics, that supination, that propelling the body forward, and controlling that excessive pronation that occurs as the foot comes down into that forefoot strike position. So the best option for this athlete is to wear a control shoe and also an orthotic. Now we see another flat foot position. Again, notice the heel, how flat it is, how inside the arch is collapsing inward. There is very little ability to propel that foot forward as the athlete is walking, and then that becomes even greater when we see the athlete go into a running motion here. This athlete also needs a control type of shoe, and that's what we see here. Now the improvement of the pronation control is significant with the running shoe on compared to barefoot running. So this athlete is in a good control shoe, allowing motion control during pronation and the ability to supinate and propel the body forward during the run. Now we see a high arch foot, or we call it cavus foot. This is completely the opposite of that flat foot position. Here, this runner does a really poor job of ever pronating, and the foot stays in the supinated position. This type of foot is a very rigid, non-shock absorbing foot, and you can see oftentimes this type of runner produces a forefoot excessive type of landing. In a shoe, now we can see this needs to be a shoe that produces a lot of shock absorption, since this foot is very rigid and produces very little pronation to absorb shock. So that has to be replaced by a shoe that is nice and soft and produces this shock absorption. Looking at the heel, you'll see that it rarely goes inward or falls into any type of pronation during her running. Now we're looking at a normal foot in which the heel of the calcaneus is perpendicular to the floor. As this athlete begins to walk and then run, you can see normal biomechanics of the pronation and supination. As the foot hits the ground, the foot goes into pronation, and then he's able to supinate and propel that foot forward during the backside running mechanics. The normal foot allows for the most efficient type of running of both the front and backside running mechanics. This type of foot can be fitted into any type of shoe that is comfortable for the athlete, because we don't have to worry about motion control or excessive cushioning for that foot. So here you see the runner in a minimalist shoe, landing in a forefoot type of land or midfoot landing position with great control of the pronation and the ability to produce supination during the backside running mechanics.